I remember this song because I've watched this video so many times.
It's actually real bad. It's much better with you doing it.
Okay.
All right, let's bring everybody back.
Here we go.
Cool. So we're gonna make that fun. That was good, John. That was really
thank
good,
you.
man. Where are you out of, John?
So, I'm the Executive Vice President of Strategic Development, and I'm going to pause it here once we get
You want to come out? You going to do the next one? You play through. I don't want to. Dude, we got Bon and Bao here. Hold on, John. Hold on.
Yep.
All right, we're going to make a third seat. Bon, come on up.
Okay.
We're going to have fun, man.
All right.
You got a cocktail? You need a cocktail.
I might have a cocktail.
Why not have a cocktail? I mean,
Bring it.
South by Southwest.
Yeah, 5 minutes.
All right, so we have the.
Am I sitting on the table?
You got this one over here. You can sit on it.
Here. Wait, we're gonna move a mic over.
Why wouldn't we go this way?
Yeah, that was probably smarter.
That's fine.
Dude, come on, man. It's late, brother. We're right on schedule. I got to do something to delay it. That's why they're it. All right, we're getting started. All the jokings aside, we're making Bon actually do some stagehand work, which is hilarious. So, how many of you remember when the and John, we're getting back to you in a second, but I'm just going to warm this up because you're going to love this. This is a big benefit for Invita Health.
All right.
So, how many of you remember when the Super Bowl a couple years ago, the lights went out?
Oh, yeah.
Anybody remember that?
Oh, yeah.
Okay, so remember when Oreo... All right, none of you are paying attention, and it's pissing me off. I'm just kidding. Remember when they did the whole dunk in the dark thing? And it was like genius, and Twitter went nuts and all that, right? So that was architected by my friend over here to our left, Mr. Bon and Bao, who has the distinct pleasure of being a couple things other than a really cool guy. One of those things is he wrote the first corporate check to VaynerMedia, is that right?
I did write the first corporate check.
And it was a pretty big one, wasn't it?
It remains to pay dividends to this day.
What time do people actually have to get to this house tomorrow to have a chance at sitting here for you and Gary V?
I would sleep on the floor.
So if I was sitting in one of these chairs right now, what I would do is I would not move until 11 a.m. tomorrow morning. Right?
Yeah. No, we're trying. We are. We are very cognizant that we are going to have, but we are making it so that it'll be possible. But we are also working on our ability to
the logistics are
to
fun.
Live stream it. Has everybody had a chance to go see the bread bot?
The bread bot,
the robot that literally makes fresh bread.
Delicious.
Well, if you haven't seen it, we're going to force you to see it if you don't get here in time, because the only place you'll be able to see the stream of Gary will be from the bot. So
when you were at Pepsi and you were 40 under 40 because you're this big deal in Fortune and all that shit, you wrote Gary a check that was pretty significant, and you guys became friends, and Gary's amazing, and so he'll be here tomorrow. But the other thing that was interesting is you were the youngest C-level executive in the Fortune 50, is that right?
Correct.
And you work for this little company called Mondelez?
Correct.
And they owned a bunch of shit.
I no longer work there, so I guess legally I can say yes, they owned a bunch of shit.
Yeah.
Oreos, Wheat Thins, Triscuits, Stride, Trident.
All right, so now we're going to talk about Invita Health.
Okay.
And I want you to understand something.
Do you make Oreos?
No,
Okay.
They don't make it.
Okay,
they have nothing to do with CPG at all.
Yeah.
But what they do have to do with is blockchain, which I know, we're doing some cool things together there. So anyway, all right, everybody warmed up, back in Invita Health. Come on, stay with me. We got like 3-4 more of these left, and then we're out of here.
All right.
All right, John.
All right.
Now, we're going to ask you questions, and we're going to ask you questions you may not like because we don't know what the hell you're talking about.
All right.
But Bonin is a really smart guy, so we're gonna get the most out of this. Tell us about what you do, where you're from, and all that stuff, and we'll go from there.
Right on. Okay, so I'm the EVP of Strategic Development and Partnerships at Invita Health.
Okay.
And Invita Health is currently on the market with a integrative career management platform for licensed medical professionals. What does that mean? So it is a digital place for them to manage their credential information, which is a very arduous administrative task for physicians and other licensed medical professionals. We also have an online CME library, which is a requirement that they have to take every year. We have a very robust jobs match and search for them with over 9,000 positions throughout the United States. And what we are doing, we also, additionally, we have a HIPAA-compliant digital messaging system. You may have heard of Tiger Text and some of these others. Well, ours is kind of Tiger Text on steroids, and it connects with over 700 EHRs and EMRs. And now our next step is that we are integrating Hashgraph, which some people may be aware of. Some people may just starting to hear the name. Dr. Lehman Baird has developed Hashgraph, and it is, some are calling it the blockchain killer, and I know that might offend some people here, but
I don't think anybody. I think we're all just here agnostic.
Yep.
Let me frame this up. So he's worked in organizations with thousands and thousands of employees.
Sure.
So
Hundreds of thousands.
Yeah, hundreds of thousands.
Yeah.
So talk about like, what is the problem you solve? Like, just layman's term it. My son Beckett's in town.
Sure.
6-year-old it for
All
me.
right.
What do you solve?
all right, so to a 6-year-old, and you say, hey, you want to get a job? And he says, yeah, I want a
No.
job.
Oh, sorry.
No, he says, yeah, I want stuff for free. Well, you got to work. Okay, so he says, hey, I want a job. I want to make some money. And you say, okay, give me all of your credentials. And he says, what are those? I say, you give me your birth certificate, and you give me your social security card, and you give me all these things. Well, a physician has approximately 20 to 30 documents at one point, at some times, depending upon how many states.
From degrees to licenses to insurance proof,
DEA
whatever.
certification,
Okay.
CPR certification, all that stuff. And
Yep.
and then the hospital says, hey, we need that. And they take that packet, right? It's in a file folder. And they literally, like they've done since 1955, they open up a paper folder. First of all, they got to get it from the doctor, which is a real pain in the ass because they can't extract that information. It's hard for those physicians to stay organized with all of this going on. They're busy. They work 60, 70 hours a week. So anyways, they get the credential packet from them, and then they go through a checklist and start manually picking up the phone in an analog fashion. And somebody in a credentialing office sits there and starts dialing and saying, hey, is this, in fact, this guy establishing reputation?
Okay.
Did this document, is this the case? And they do it for every single document.
So it's just it's paper. It's paper.
It's old school.
On steroids.
It's paper. It's
And you
verification.
get rid of all that?
Yes, sir. So what we do,
Okay.
is we already have the platform built for the entry of the digital documents, so they can upload the documents currently to keep we can store, manage, and share all of those documents. By the way, this is absolutely no cost to the provider. Okay, so it's free.
Okay.
And it's also free for them to communicate with any facility or medical group that they work with. Okay, so this is an open ecosystem that allows for information sharing. All right. Now we are building. Once we integrate the Hashgraph, which we will be the first enterprise level company to be putting a market application out on the market,
With Hashgraph?
with Hashgraph, that's correct.
Okay. And when you say you're the first, like, is this going to happen in 6 months? Is this already happened and we're just finding out about it? What do you got in the roadmap?
So we're in the process of integrating right now. The platform exists, and now we're integrating the actual DLT portion of it.
Distributed ledger technology.
That's correct. That's right. And we expect to be live. Well, we expect to be in beta late spring, and we expect to be live early summer. And so that puts us out before anybody else on Hashgraph.
I guess my question is, so it's not a new problem,
Correct.
but yet we weren't able with previous technologies to get physicians to solve that problem.
Exactly.
But the question is, why, and what makes you believe that you'll be able to? Because there's not like I couldn't digitize those 20 documents
Right.
and share those 20 documents before blockchain.
That's right.
And so, yes, I can do it in a better approach now, but what makes you think that doctors are going to shift to that when they weren't willing to do it before?
Okay,
Great question.
That's a great question, and
Well, thank you.
And I believe I've
Great
got the
hair,
answer to
too.
that. One of the traditional model, SaaS models that are out there now, you end up with these silos of credential information in each facility, and the common thread between that information is the provider. So hospital A has the provider's information at a certain level of accuracy, right? It may be outdated. Facility C has some of that information, but again, at a different level of accuracy, and maybe it's outdated. And so what we allow is,
So an example,
Yep.
and we all know what accuracy is,
Sure.
but just as a really like granular, because
Yeah.
he's asked a great question is, so I have to verify multiple copies of maybe the same thing, but they might be different.
Right.
right?
Absolutely.
So who's doing that?
The person that picks up the phone and calls. And so there's this completely disjointed system of what they call primary source verification that's analog, and everybody has to verify separately.
But why will the doc do it?
Okay.
Why will they believe you? Because that's the real thing is, like, they know digital, they could scan this, and I know you have an answer. I think it's the right, like, why will this scale? Why will the doctor finally do it?
Why will the doctor? I mean, most of the challenges that we've had as we try to provide solutions to existing systems in paper-based has not been necessarily purely the technology,
correct,
but has been the intrepidation of the knowledge level of those that we're trying to.
So we have two angles on that. One is this. We benefit the facilities the most, right? And so the facilities actually control that information more intimately than the physicians themselves. So what they're called administrators, right? So physicians have administrators at every facility that they're at, and they may even have a private administrator like a secretary, or we also know from studies that it's their significant other, husbands or wives. So they're looking for a better way to handle that information. So what we do is we put it on a silver platter for them. We make it as easy as possible by allowing administrators to set up the accounts, organize the accounts, and actually facilitate those back and forth. Now, the provider owns the account, owns the information, and gives permission to those administrators to manage those accounts. But they're all in one repository for that provider, and we allow access from different
facilities. So no matter where that physician practices, is this an externalized shared single source of truth, like we've been talking about a lot today, where I could float around to hospital A, practice B, wherever I do surgery or whatever my practice is, and that's immediately available in real time to whoever needs it. And is the incentive then for my admin, because it doesn't sound like the doctor is even going to be aware of it, doesn't need to be, is the administrator of me, is it about billing? Is it about profit? Is it about, like, what's the incentive? Is it pulling money through faster?
Mm-hmm. So a couple of different things. The current process of credentialing, okay, so or gaining of privileges at a particular facility, depending upon the size of the facility, can take months, okay? So you get the job.
Yes!
You got it.
Oh, sorry.
You're hired.
And now you give me your credential packet.
Finally.
And you've got to wait for 2 months to find out if they find any dings in your licenses or anything that you might not get the job. And so now exactly. So it takes that time. So you take it from months to seconds.
Okay.
So and
who's incentivized to do that? The facility? Because the facility wants to clear. I mean, clearly the doctor wants to know whether they got the job or not.
Malpractice goes down too, right? I mean, right?
It is conceivable that can happen.
Or maybe not. Maybe you just
that's
don't
no.
have a claim.
It's conceivable.
Yeah, conceivable means no. But what it means is it's not going to go up.
Yeah. Well, let me ask a question. So it sounds like what you believe is that even though you could have digitized these before, with blockchain, because now you know that the elimination of multiple verification and silos of data, that will cause the industry to see the opportunity and move faster to it?
Yes. So,
and you're saying Hashgraph. So explain to the folks Hashgraph versus blockchain, because you're saying something different. You're making an announcement today. So make your announcement.
All right. So,
and then we'll figure out what it means.
All right. So
in the last 7 minutes.
Well, the first announcement is the fact that we are the first. We will be the first commercially available Hashgraph decentralized ledger technology solution on the market in an applicable niche, which we're in health. But we're actually going to be the very first in any case.
And what's the difference for again, you don't have to go 6 years old, but go at least to 15.
So,
Hashgraph versus blockchain.
All right. So the biggest difference is speed. Now, I encourage all of you to look into Hashgraph and understand how it operates, but it works on a gossip protocol, and additionally, it works on a virtual voting system. Okay, Dr. Lehman Baird developed it, and it's the capabilities of Hashgraph over blockchain are speed, fairness, and security.
We got you off your slides, and I so fucking love that.
That's all right. So, no, the main thing, I wanted that up there to show the token sale. So the main thing is that we were not able to actually put this solution that we were attempting to achieve into a typical blockchain solution because of the lack of speed. It just would not operate at a UX level that we could justify. We've been looking into this for over 2 years. So the main thing is security. We have to. We hold the doctors, the physicians' professional lives of documentation in our organization. And if we were hacked or we were breached, that would be probably a company-killing event for us. So the first thing is security. Secondly, it allows us for this credential verification house of truth. We become the standard for which all primary source verification will be done in the future. Okay. And that's truly why we've worked with Hashgraph.
So let me ask. So
yeah, go ahead.
Just real quick. So you said you don't charge the doctor,
Correct.
free for the doctor, free for the facility. So where is the monetization?
We're like that last guy who doesn't know.
Yeah. Nobody pays.
No,
They just get benefits.
Sounds it just keeps getting
Socialism.
better.
This is the best part. So here's how we work. We work on a sponsorship model. So we work with a number. We have currently established a number of partnerships.
So sponsors. Good.
So we're like, for example, continuing education. Okay, so
Oh,
So
gotcha.
CME will sponsor so they get access to the doctor.
Yes, and we put so for example, they all are required CME content, and they have to
Okay.
take these credits. So that's one way.
So
then
your customer is
pharmaceutical-
actually the CME, the doctor's the product.
Yeah, pharmaceutical.
Pharmaceutical.
Okay.
Medical malpractice is a huge one. We have
Insurance.
a partnership with AJG, which is the largest malpractice insurance.
Got it.
Gotcha.
And if you think about it, we have
That's a
curated goods and services.
that's a hard place to bet a business on, don't you think?
I don't know.
It depends on the scale of the ability to move doctors over.
We already have thousands and thousands of doctors operating on the platform now, and facilities. So really, the facilities drive the doctors in. Okay, the facilities.
Well, and they're all managed now, right?
And
Because they're all managed services.
They say,
now.
Dr. Smith, you have to use this system.
Yeah, the doc doesn't care. The doc's too busy trying to make a living, and the facilities are basically driving us now.
Correct. Now, additionally, we have announced that we are launching our token presale
Okay.
on April 19th. Now,
And where are you doing that?
So we're actually using ERC20 right now.
Okay.
But there is a lot of rumors going around. If you are in the Hashgraph world, the Hashgraph will be launching a public ledger at some point, which will allow for tokens. And when that happens, if that happens, then we will launch.
Will you do a
we'll
secondary?
burn. Yeah, well, no, we'll do a one-for-one burn. We'll put it
Okay.
on the platform and we'll burn the other.
So you convert. Okay.
Yeah, we'll convert.
And you're launching when?
April 19th is the pre-sale.
So you're in private sale now.
Or
are you doing a private sale at all?
Just now, no. There's no
Okay.
pre-sale.
Okay.
So,
and how have you capitalized to date? Founder money? How
Yeah,
have you...
so we have a network of angel investors who have funded us, and thankfully, thank you all investors who have put money in. And so the next generation or the next iteration will be funded by this token sale, and we're really excited about it.
What are the feature sets
Yeah.
that you're going to add? And then I'll go to Bonnet, and then we'll go to the crowd. And we've
Well,
got several minutes left for the crowd. So
I wanna
talk
iterate-
about what it's going to do.
Yeah, so I want to tell about there is a token economy here. I mean, this is a legitimate utility token. So when the providers are in the platform, they will earn for doing activities in the system. So if they upload a document, for example, or if they apply for a job in the platform, they will earn tokens. Then with those tokens, they can purchase CME content. They can put that towards malpractice insurance. We have a marketplace where they can use that for all different types of curated goods and services in the healthcare space.
So that's cool. So you're creating, that makes a lot of sense. So then the token, how are you reaching out to the CMEs? Like, where's your marketing spend right now going?
So
As you relate to that, because
Yeah.
that's several
So-
people to communicate to.
So we're doing a lot. I mean, we're
Guys,
working-
can we keep it down just a little bit in this room, just so we can? I know it's getting late in the day. We've got 3 of these left. I want to make sure everybody's clean.
Yep.
Sorry, just wanted
no problem. So we're working a number of different approaches for marketing. So facility medical groups is a huge outreach for us. So we do direct partnerships. We offer the platform for them to use for credentialing solution. and for free, right? So that's actually one of our marketing outreaches. Come and use our platform for free. Include your doctors, and you get all this utility, and you can use this. And by the way, if you have a CME course or if you have a job that you'd like to post, go ahead and bring it on. So a lot of our strategic partners end up becoming our clients. Okay, so that's one of the models. Additionally, we use a lot of the traditional digital methods between Google Ads and very robust email campaigns. And we have a lot to offer because we have 8,000 positions, jobs. We've got lots of CME content.
How many physicians are there in the United States?
About 925,000.
Wow.
So 8,000 is 1%.
Mm-hmm. And then nurses.
How fast, right?
Yeah.
How long you been around?
So
just under
about
2 years?
Yeah. And so we've been scaling.
And you've had product for how long?
So we've been on the market with this platform for about 8 months.
Okay, so that's pretty good. 8,000 doctors in 8 months.
And we've got a and also too, we've just really started to ramp up our marketing.
Right.
And things are clicking.
And most
quickly.
of that is pushing to the hospital and letting them push
a lot of it is
or
to push a push.
Yeah, that's a question. Is out of 900,000 doctors, how many actual facilities are there?
Mm-hmm. That's a good question, and I actually do not know the answer to that. I apologize.
But it's less.
Whoever's watching.
I hope so.
Yeah. So that.
I'm no mathematician.
But it's less.
So,
but that means it's easier in the sense. In one way, it could be easier, right? Because there's less CMEs.
Absolutely.
There's less facilities, and so the
groups,
focus becomes if a facility. And I'm making this up.
Sure.
If a facility's got 100 doctors. I got to go after, like 9,000 facilities.
Well, then there's also bigger facilities, bigger managed care groups.
Sure, yeah.
I mean, you've got these huge groups,
huge hospital groups.
And if once we establish the credential verification system, we believe that they'll be knocking on our doors.
And the sale to them is just faster.
Faster, cheaper, much cheaper, and you can reallocate. I mean, ultimately, our goal truly is that we give time back to the physicians, we give time back to the hospitals, which equates to money. They can deploy those resources in better care.
Well, patient experience changes too.
We're attempting to improve the healthcare system from an
You're tackling a really
process.
small problem. Good for you.
Yes, that's right,
dude. No, seriously, and we were tough on you. We were tough on you.
Oh, yeah.
But I think that's the point. Is that you've got something real. We only had 20 minutes.
Yeah.
Ask them some questions. Take them a little deeper on some of this stuff. They're opening around April
19th.
Accredited only.
And actually, a unique part of our offering is that accredited U.S. investors will be able to participate in the token by purchasing shares of Invita Token Inc. And the tokens will be a shareholder benefit. So according to the latest SEC guidelines, we are 100% in compliance.
Cool.
And so, this is something that we believe is, going to be the future of how tokens are offered on the market.
That was awesome.
Love it.
Oh,
So I can invest directly into the company, get equity stake, and get tokens as a bonus?
that is correct.
What is your plan for exit? What do you guys going to do for distribution on
Yeah, so this particular sale will be a Class B share, and our exit strategy is in the next 24 to 36 months. We're looking at one of those giant healthcare systems or information systems to come and scoop us up.